Today I'm here to talk about my procedure of the dental veneers that we completed a couple of weeks back and let you know a little bit about the procedure and the results. Dr. Alexander Ye at Smiles Dental Group restored 8 of my teeth with porcelain veneers. We did the procedure about a month back. Previously, I had a accident and had a dental implant and a couple of porcelain crowns placed. To be completely honest, I was never really happy with the initial procedure that was done outside of this practice at another specialist office, because I felt like the veneers that were done were not similar to my natural teeth, and I was always a little bit self-conscious over the placement of the teeth. Now that we've had this procedure done, I couldn't be happier with the results. I think my teeth look amazing, and I'm very happy with the shade and overall appearance of my smile makeover. To ensure the most optimal result for the patient, Dr. Ye sent me to the dental lab where we did custom shading and a wax up of my case to make sure that the shape of the teeth and the staining was going to be natural, and I would be happy with the whiteness of the teeth. Some reasons to do dental veneers would be to have a whiter, brighter, better aligned smile, but they can also be used to repair or replace broken or damaged teeth, and they also help with sensitivity. During the procedure of waiting for the case to be completed by the lab, we placed 8 temporary veneers on my teeth, and they actually worked out perfectly. They looked just like natural teeth, and they lasted for the whole month that it took to complete my case and get everything ready to be completed.
So this is the live smile enhancement procedure. At this point, we are taking off the temporaries. We have already prepped and temporized, and the lab has already fabricated the porcelain restorations. So we're removing the acrylic temporary crowns and or veneers. Here you see I'm cutting the acrylic off. And we are also removing the temporary crown that is on the implant site. So we're just cleaning up the preps, removing any excess acrylic. So the technique here is just to cut a slot, cut interproximally with a fine needle type diamond. And so that's my favorite burr to use, is that really thin mosquito diamond. So we're just using a scaler just to remove the acrylic shell temporaries. And again, those temporaries are just there for aesthetic purposes, as well as it prevents the gingiva from overgrowing onto the margins of the preparations, as well as maintaining the interproximal spaces between the prepared teeth to prevent shifting or super eruption, and of course to prevent the teeth from being sensitive while she's in temporaries. And right now, so we are putting the porcelain crowns and or veneers on just to try them in and make sure they all fit. The implant had a custom zirconia abutment made, which I screwed in already. So all of the porcelain restorations, whether they be veneers or crowns, are tried in. They fit quite well. So I don't typically do traditional veneer preparations. I do what some people refer to as 3/4 crowns. And then on the premolars we have traditional crowns like full coverage restorations. And then the implant supported crown, of course, is a full coverage restoration. Every other tooth is a 3/4 crown, where the lingual is not, the palatal part is not prepped, but every other surface, the incisal, facial, and interproximal surfaces are prepped. So right now we're just making sure everything fits well. I've got some small adjustments where sometimes the preparations have slight hang-ups and they need to be smoothed out, which is what I'm doing. Here I'm just making sure we're torquing the zirconia abutment to the implant to the correct torque, which is 35 Newton centimeters. That's a little torque wrench that engages the screw in the zirconia abutment. So here we're cementing the porcelain restorations because there's so many of them. We're just going to do the first quadrant first, and then we'll do the second quadrant after. Right now I'm doing the implant supported crown before anything else because we're using a different cement for that particular crown, that zirconia crown, or porcelain fused zirconia crown. Now we're using the etch for the teeth, which is a 37% phosphoric acid etch. Once that's etched and rinsed off, we dry it. I think what we missed the bonding step. So obviously we did bond the teeth. We put a bonding agent on all the teeth and air dried that. What you're seeing now is the step after that, which is the cementation of the porcelain restorations. What we also missed was the step where we prepared the porcelain, the internal aspects of the porcelain restorations with a porcelain etch and then the salinating agent. The porcelain etch being a 9.6% hydrofluoric acid etch for the porcelain. Right now you're seeing the cementation of the first quadrant of restorations, and we're using a resin cement, which is light cure. Now we've moved on to the second quadrant. I used to do all the unit, like didn't matter how many units I did, I used to just do them all at the same time. I found sometimes that it was a bit rushed when we did that, when we did like 6, 8, 10 or more units at the same time. It was a bit rushed. This way we have plenty of time to get things right, make sure everything's seated correctly, cleaning up the excess cement, and then of course light curing everything, which I mean, everything doesn't take, this step doesn't take a lot of time. It's just less things can go wrong. So some people just like doing everything at the same time. I used to do it that way, but now I don't. So this is a light cure unit. So we're just spot curing. So what we're doing is we're just curing kind of the gingival aspect to just lock the porcelain restoration in place, and then to prevent any marginal leakage of saliva and or blood. And we'll do the lingual aspect as well, or the palatal aspect. And then while the cement interproximally isn't like rock hard, we're gonna floss in between the teeth and just clean out as much of the cement interproximally as possible. If the patient's gums start to bleed or hemorrhage even slightly, we're going to light-cure immediately so that there's zero chance of contamination underneath the porcelain restoration. So right now we're just checking the occlusion, which is a really important step, especially when you're changing the shape of the teeth. You're going to end up having high spots for sure, and that takes time to adjust all these areas of high occlusion. So now we're just taking a bite registration and impressions for her night guard. So we always do a bruxism appliance for all of our smile enhancement patients to protect our investments. One of the most destructive things that you can do with porcelain restorations is grinding them at night. And here's the before. You can see that there's some obvious asymmetries and discolorations. And then here you have the final result. In the middle, you see the temporary restorations.
Two considerations to make when choosing to do dental veneers is how many teeth you would like to do. If you'd like to go brighter or whiter, it's always a smart consideration to make to do more teeth because of shade matching and to ensure that the teeth look natural and like they're your own teeth. And the second consideration to make would be getting a night guard or orthotic, because during the nighttime it's very important to protect the veneers when you're sleeping and to avoid any issues with bruxism or teeth grinding. If you're interested in a complimentary consultation for a brighter and wider smile, give us a call at Smiles Dental Group. We accept new patients at all of our 7 locations throughout Edmonton and area.